The increased risk of stroke following any type of traumatic brain injury is well known. A new comprehensive review of the medical literature in an article entitled Risk of Stroke After a Traumatic Brain Injury, a Systemic Review and Meta-Analysis, published in the ACAT Neurological Journal this November, confirms this risk. Traumatic brain injury is a leading cause of death and disability in the United States, and is associated with increased risk of all types of neurological disorders, including seizure disorders, Parkinson's disease, ALS, dementia, and Alzheimer's disease. This comprehensive literature review confirms the relationship between brain injury and stroke. The review found across the spectrum of all types of TBI, mild, moderate, and severe, patients were at an increased risk of both ischemic strokes caused by a blood clot in the brain and hemorrhagic stroke caused by bleeding within the brain. This risk of stroke is at the highest levels in the first 3 months following any type of traumatic brain injury, pointing to the need for careful monitoring of all patients suffering from a TBI for the signs and symptoms of a stroke. And although this risk then goes down, it is not eliminated, and patients still need to be monitored. In patients who may have developed a carotid or vertebral artery dissection, bleeding in an artery of the neck following a neck trauma, in patients taking anticoagulation medication, blood thinners, which increases the risk of bleeding, and in the elderly, monitoring for stroke is essential following any type of traumatic brain injury. So let's review the warning signs of stroke. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. And sudden severe headaches with no known cause. Remember, time is brain. Fast treatment can reduce the brain damage that any stroke can cause. So if any of these signs appear, or you think someone else is having a stroke, it is essential to call 911 without delay. There are recognized stroke treatments available. Stroke patients may not be eligible for these treatments if they don't arrive at the hospital in time. So it's important to seek treatment without delay. Thanks for joining me this week, and I look forward to meeting with you again next week on a new edition of the Brain Injury Insider.